Now, when we talk about our outreach and the support that we receive on the policy level, when we talk about our ability to be here today and have our reception last evening, and the genesis for our summits back in 2005 began with two people, as I mentioned yesterday. Senator John Kerry, who's now the Secretary of State, and Congressman Gregory Meeks. Congressman Gregory Meeks is, again, as I indicated yesterday, is my congressman. He has a district in New York, but somehow I got adopted by him in 2005 because since then, and let me say, he's a great leader. He's a great congressman because he has been here with us for each of these 10 years. And he makes this possible. And without him, I'm not sure where we would be. With him, I know where we're going. We're going to continue to make progress in the fight against prostate cancer. So ladies and gentlemen, I'm pleased to introduce Congressman Gregory Meeks from New York.
Good morning. Good morning. Let me first welcome you to the 44th Annual Congressional Black Caucus Foundation event. Let me also apologize for not having a strong voice this morning. Some of you may know that I am from New York, and New York had a football game last night.
That's right.
Against the Washington Redskins.
Yes, right.
And I don't have a voice today. So you know what that's about. Let me but first thank the Farringtons. Tom, let me say to you, you are such an advocate, so focused, trying to make sure that we make a difference. I can't tell you how proud I am of you and the work that you've done and the lives that you have saved. You are a tremendous, tremendous man that's making a difference in the lives of men throughout these United States of America. And we thank you for that. Mrs. Farrington, as he said, I know that he couldn't do it without you. And you are there. You make the sacrifices so that he could be there, and then you partner with him. So we thank you for your commitment, for your continuing to push to make sure that tomorrow is better than today. Thank you for your contributions. To the members and affiliates of the Prostate Health Education Network, and of course to all of you in attendance who know how important this is, so you're here first thing early in the morning. And I know, as they say in church, that you've come this far by faith in your mission of raising the awareness and expanding the effort to overcome the glaring disparity in the incidence of prostate cancer among African American men. You know, it is remarkable that we are celebrating the 10th anniversary of the first African American Prostate Cancer Summit. And I can recall, and I bet there's more folks than others, that thought that this event would be just a one-time deal, like a fad that would quickly fade away. You know, sometimes when we come to the Congressional Black Caucus weekend, people say that there's no follow-up, you know, from one workshop to the other, or from one year to the next. But you've been here for 10 years, focused, talking about what you did the year before and what you're going to do the next year after. That's what this is all about. So I thank each and every one of you for being here and your commitment to make sure that we erase the disparity of prostate cancer in African American men. 2003, and this is 2014, and the collaboration with PHEN under the inspired leadership of Tom Farrington and the Congressional Black Caucus, and we were looking back to say that it's fair that the Disparity Summits have contributed to the progress that is being made in broadening the disparity of the disproportionate danger prostate cancer poses for the health and longevity of African American males, and by extension, of course, their families, friends, co-workers, employees, students, congregants, neighbors, fraternity brothers, and the fans of black men who have been inflicted or taken out by this disease. I've had a few people in my office who are prostate cancer survivors since we began in 2003. And I know that we can say without exaggeration that the annual African American Prostate Cancer Disparity Summits have contributed to the advancing of the fight for early diagnosis, effective treatment of prostate cancer in African American males, and these events, which have also become a venue for dialogue and information sharing between experts, doctors, researchers, pharmaceutical firms, community institutions, as well as those of us who are elected or hold elected office, have made a unique, and I would add, an indispensable contribution to the progress that is being made to reducing the death rates among African American men due to prostate cancer. So as Mr. Farrington indicated, we can report with pride that PHEN and the Congressional Black Caucus have worked together to increase awareness of the House of Representatives and the United States Senate of the disparity in the occurrence, diagnosis, and treatment of prostate cancer in African American men, and by working with congressional allies within and beyond the Congressional Black Caucus, including senators and representatives who attended summit sessions. You know, you have a lot of members that have come by here, or the annual luncheon, some of whom had family members or staff members who had prostate cancer or were themselves treated for prostate cancer. The PHEN-inspired disparity awareness movement helped increase federal funding for research on this crisis. Without you making us aware, we had a push. You actually helped increase the funding. And each and every year, more and more, listening to what was put forward by Mr. Farrington, more churches, more social organizations, educational institutions, fraternities and sororities within the black community have taken up the challenge of spreading awareness about African American prostate cancer crises. Significant progress is being made. Over the past 10 years, Mr. Farrington just said, the cancer death rate among African American men dropped by a spectacular 40%. Much of this drop is thought to be due to growing awareness among black men of the importance of early detection, which has led to dramatic increase in the number of black men taking PSA tests. From barbershops to pulpits, to radio and television talk shows, to the halls of Congress, all who have been involved in the African American prostate cancer disparity awareness movement deserve a pat on the back. And I know who really deserves 5 stars, and that is PHEN, because you are the leader of the pack. But, you know, I always believe, because we got to caution that we can never, and I know Mr. Farrington, looking at the program, looking at for next year and the year after that, we can never rest on our laurels and take our foot off the pedal. We've got a lot of work still to do, because despite the progress, the disparity is still with us. African American men continue to have the highest prostate cancer death rate compared to all men. Prostate cancer is the second leading cause of cancer-related deaths among African American men. Prostate cancer accounts for approximately 37% of all cancers occurring in African American men. And an estimated 4,980 African American men die from prostate cancer in 2013. In 2013, an estimated 35,430 new cases of prostate cancer in African-American men were diagnosed. So we've got work still to do. You know, I would look forward to the day when we do put this annual conference out of business because we have reduced disparity and stopped the deaths of African-American men to this disease. So, as we review the progress we've made since the first PHEN CBC Prostate Cancer Disparity Summit as a down payment on the broader, bolder, and more bodacious efforts that we must unfold. We found our bearings over the past decade. We laid the foundation for a level of advocacy we must reach not only across the length and breadth of the Black community, but also across the length and breadth of the medical community, the healthcare community, the media, the pharmaceutical industry, and especially federal, state, and municipal governments. Americans of all backgrounds, all descendants, Democrats and Republicans alike, at all levels of government from every region of our nation must continue to come together and form deeper coalitions and stronger alliances if we are to defeat this disease. In closing, let me underline the emphasis I just placed on the level of the government and the body of government of which I serve, the federal government, the United States Congress. We've got a bigger role that we must play. Much of the progress we have made can be attributed to enhanced federal government funding for prostate cancer research, for research on the causes of the disparity, and for public educational programs that elevated the awareness of men who are high risk and their families, communities, and doctors and healthcare providers. The bottom line is that accelerating the fight to reduce and end the African American disparity has to be better resourced. Additional research, additional outreach, additional testing, additional treatments are required, and it therefore needs additional resources. I was listening to Mr. Farrington. Many of the individuals he talked about here at PHEN don't have the resources, because if you had the resources, you could do even more. So I support the call and the challenge that Mr. Farrington always gives us at the Congressional Black Caucus to take the initiative in a campaign for enhanced federal funding with respect to increasing the appropriations for prostate cancer research within the Defense Department's congressional mandated direct medical research program. We need to fight and make sure that we are funding this. And you know, sometimes I think about it, and it's a good thing. You know, I don't like to talk about others and chat with other diseases that are receiving funding. You know, we had the challenge, the ice bucket challenge, and it brought attention to a lot of folks with reference to Lou Gehrig disease. We've got to bring that same kind of attention. We've got to figure out how we challenge our communities throughout America so that we can bring the resources to PHEN and organizations like PHEN so that we can make sure that we eradicate these diseases. So those out there in congressional districts around the country, those who are survivors, who are the family and friends of the men who lost their battle against prostate cancer, and those who are concerned about the disparity about men at high risk, about research, about funding, about early detection, about effective treatment, are the ones who can make this happen. If we organize, if we mobilize, if we educate and advocate, if we build coalitions around this country, we will win the funding needed to accelerate this fight. The squeaky wheel always gets the oil. And that's what we need to continue to do. Consistency makes it happen. Government moves slowly, but it's those that push the system, those that push for funding. That's how it happens, those who advocate. And you come from all over. Some of you may not have a Congressional Black Caucus member that's your representative. It is even more important then to go to those who are not members of the CBC and let them know how important it is for them to be part of this struggle and to join us so that we can make a better and healthier tomorrow. Because not one life should be lost to this disease, because we can get the information out and get individuals to have early detection, because that is the key to eradicating it. And so I thank each and every one of you for being here, for continuing the fight. I thank the partners of PHEN for making the contributions, because indeed I believe that it won't be too long that we can stand up here and have a closing session saying that we have won. We have won. We have won. Thank you. May God continue to bless.